Here is your question. Right. So if you have read and understood considering its surgical and optimization, kindly please tell me what image are you looking at? If you can identify the one on the left-hand side first, the marked structure.
This is a cerebral angiogram.
Yes. The right side it's showing. So if
Showing
you, yes, if
just
you can, yes, please.
A is the middle cerebral artery.
Okay.
B is the internal carotid artery.
All right. See.
C.
And then D.
I don't know, ma'am.
Okay, D.
D is the anterior cerebral artery.
Yes, E
F is also E is
or F. You
terminal
can tell
branch.
first.
F is also anterior cerebral artery.
Yes. If we move on to the right-hand side image, if you can identify what this E is.
E is internal carotid artery.
Okay. What is this B?
B is also internal carotid artery.
Okay. C, please.
C is the cervical part of internal carotid.
Would you be able to identify D, please?
D is probably anterior cerebral artery.
Okay. If you can tell me about the internal carotid artery, how the course of internal carotid artery, how and where it enters the skull and what happens.
It originates from the common carotid artery at the level of C4. From there, it ascends upwards and enters the cranium through the carotid canal.
Yes.
And then it turns medially through and runs through the cavernous sinus and goes upwards and terminates.
Once you are telling me, kindly tell me where it gives off, how many branches and when.
In the cervical part, it doesn't give any branches. As it enters the skull, it gives ophthalmic artery, and later it gives anterior cerebral artery, middle cerebral artery, and anterior choroidal artery.
Yes.
Branches.
Yes. Okay, we'll move on. If you can, in this image, identify what this B is, and then A, please. And what kind of image is this? When could that have been taken? Yes.
This is a vertebral artery angiogram.
Okay. So what is the course of vertebral artery?
A vertebral artery originates from the first part of subclavian artery. From there, it ascends upwards and enters the transverse foramen transversorum of C6 to C1. And at the level of C1, it traverses the posterior arch of atlas and it enters the cranium through the foramen magnum in the subarachnoid space, and it then ascends upwards and medially in the lower quarter forms. It fuses together to form basilar artery.
All right, good. All right, okay. If you can, if you can please tell me, you already told me about the internal carotid artery. So if you can tell me if a patient suffers from middle cerebral arteries infarct, so what would be the signs with which patient will present?
Contralateral hemiplegia of the lower part of face,
Yes.
contralateral hemiplegia of upper limb and lower limb, and
Yes.
aphasia if dominant lobe is involved.
Okay, good. What is the most common abnormality of middle cerebral artery that can be seen or can be of clinical significance?
There can be very aneurysm of the middle cerebral
Yes, yes, which there can be, yes, possibility of rupturing perianeurysm. Perianeurysm is associated with other clinical conditions as well. Can you name in adults?
It's associated with polycystic kidney disease.
Yes. Okay. If you are asked to identify foramen transversum, how would you identify it? Especially the
These are
cervical
foramens.
vertebrae. Yes.
Yes, these are foramens that is seen in the transverse furrows of cervical vertebrae.
Yes.
From C1 to C6.
Yes. Okay. Right. Can you locate the position or where this aneurysm can be located, or how does it, if it coordinates with any particular significant point, clinical point, if you can tell me?
At the origin of middle cerebral artery.
Carry on. Okay, if you can look at this image and identify all the structures, starting from A, please. What kind of image is this?
This is a carotid angiogram.
Yes. In which situations or conditions is it asked for? What can be done?
In case of stroke,
Okay.
we are suspecting carotid stenosis,
Okay.
or in very suspecting aneurysm.
What about in subarachnoid hemorrhage? Maybe. All right. Okay.
Also in subarachnoid hemorrhage.
When you suspect, yes. Okay. Can you please now identify the structures?
A is internal carotid artery. B is anterior communicating artery. C is anterior cerebral artery.
Yes.
D is middle cerebral artery. F is E is basilar artery, and F is posterior communicating artery.
Okay, good. Next, what this arrow is pointing at, please?
It's pointing at Berry aneurysm.
Yes, good. Okay, if you can, right, there is one more. If you can identify, there is one arrow here, if you can identify this one. And
on the right side, it is middle cerebral artery.
Yes, and this one?
This is internal carotid artery.
Yes, very good. This is also middle cerebral artery, and which branch would that be?
This is anterior cerebral artery.
Yes. Now, can you please tell me the blood supply of the brain, how a circle of Willis is formed?
A circle of Willis is formed by anterior cerebral artery, anterior communicating artery, internal carotid artery, posterior communicating artery, posterior cerebral artery, and basilar artery.
All right. Okay. Right. Yes. You told me that, correct, and now they went. Okay, good. Excellent. Nice. Wonderful. Thank you.